Hey guys, Tony Maritato here, licensed physical therapist, and we had a question come in through the Facebook Total Knee Replacement Support Group for Kind People. I'm going to read the question. I'm going to give you my quick response because I'm just getting ready to go out for a run and then go into the clinic to treat patients. So the question is, Tony, how do you know when to work through the pain or to rest? When is it safe to try again? I had a Baker cyst behind my knee which burst during surgery. I did pretty well up to a few weeks ago. Now, I don't know how long ago surgery was yet, but let's keep going. I did pretty well up to a few weeks ago. Now the pain behind my knee and on the outside is pretty bad. I rest a few days till it eases up, then try again, sets off the pain again. I need advice. I'm 9 weeks post-op. Thank you. That's what I needed. I'm 9 weeks post-op. I have 135 degrees of flexion and 0 extension. So first, virtual high five. That is phenomenal. I can't even tell you how many people would really like those numbers. I mean, that's full range of motion. Like, no matter how you slice the pie, that is full range of motion. Congratulations to you. The Baker cyst, let's kind of hit a couple of these topics. The Baker cyst, isn't necessarily something to be concerned of. You know, there used to be a saying, and I don't know how true this is, maybe you guys watching would remember this, like cysts develop all over our body. So I used to get one on my wrist when I did a lot of manual therapy. The cyst would develop. Somebody told me once that their grandma used the Bible, slammed it down on their wrist, and burst the cyst. Cysts are there, they burst, they come back. It's not really something that I would be too concerned about. It's definitely something, you know, we want to make sure that it's certainly not infected or cancerous or something like that. But once we've determined, kind of ruled out any potential harm or danger, the cyst in and of itself is what it is. It's a frustration. It's a symptom of maybe a bigger something going on in the body, but I wouldn't worry too much about it. The fact that you're trying to figure out, right? First, if you're 135 at 9 weeks, that is just insanely good. What you're doing now, or at least what I would be doing with my patient if you were my patient, is I'd be looking at function. I would say, okay, what are the functional things that you want to do? Are you able to go up the stairs normally, step over step? If you are, then are you able to go down the stairs normally? Going down is more advanced than going up. Are you able to get down on the ground and then get back up? Are you able to sit on a commode and get back up? Like, what are the functional things you're still struggling with? What kind of activities do you want to get back to? Do you want to go golfing and fishing and hiking and doing things like that? Do you want to get in the garden? And I would be focusing the program around those things and less around specific exercises. The specific exercises have gotten you to this point, which is incredible. Yes, there are going to be some things that cause more pain, more discomfort, increased soreness. I would just start swapping those things out. If you're doing 3 or 4 exercises on a daily basis and you find that one of them is the culprit that's causing you more discomfort, more pain for the next 24, 48 to 72 hours, I would think, why am I doing this? What's the benefit of this for me? And then how can I do this differently? You know, so if I have somebody that maybe is doing a version of a squat, and the version of the squat is putting them in a position that's increasing their pain for an extended period, more than 24 hours, I would pull the squat out. As much as I love the squat, I think the squat's an incredibly beneficial exercise for function throughout your day. If it's causing you to be in more pain for the next 2 or 3 days, there's something wrong there that I can't necessarily see because I don't know you. I've never evaluated you. This is not medical advice. But I would then switch to say, okay, I'm doing the squat to strengthen my quads, my hamstrings, and my glutes. Maybe I'm going to switch that to a version of a lunge. Maybe I'm going to switch that to a version of a step up. Maybe I'm going to switch that to, you know, a version of an assisted squat, holding on to the kitchen sink so that I take some of the pressure off. It forces me to change my positioning at the knee. And if I can do that without the increased pain, then that's where I'm going to progress. And it doesn't mean I never go back to a bodyweight squat. It just means that I step away from the exercise that's causing me more pain because my body can't handle it at this point. I strengthen and improve with other activities, and then I go back and I test the original activity. I do it in a month. It flares me up again, just not as bad. Okay, so I go back to my program. I continue to do the exercise that don't cause me more pain. And then a month later, I go back and I test the exercise again. And maybe this time it doesn't cause more pain. My body's adapted. But at 9 weeks, you are so young and early in the recovery process. There is no way I'd be pushing through pain at 9 weeks with your range of motion and the metrics that you've shared. You are, I would give yourself until that 12th week mark before I really look to start doing more challenging things, pushing a little bit. But even at the most intense, even at, if you told me you could do the elliptical for 30 minutes, you can go on a hike, you can do these things. If you're not fully recovered by the 24-hour mark, I work out on Monday. By Tuesday, the same time, if I'm not fully recovered, the intensity of Monday's workout was too high, or the activities I chose to do in Monday's workout were just too difficult for me. So I would change it, scale it, talk to your physical therapist about it. I do believe, and I know this isn't popular, there is benefit to, you need to go through the pain to get the gain. But at 9 weeks, that's not the time for that. And at 135 degrees of flexion and 0 extension, you really don't need that. Your body's still recovering from the surgery. I would appreciate the gains that you had, celebrate the wins that you've had, back the intensity down a little bit, focus on other areas, your arms, your shoulders, your neck, your abdominals, your back, your hips. Like, there's so many other things that you could and probably should be working. Give the knee a little bit of a break. Focus on your diet, focus on the mental, the emotional, make sure you're sleeping to the best of your ability. You will get far greater gains by approaching yourself as in a holistic way where you're looking at everything and not being so focused on the knee. That being said, I bet if you scale the intensity back a little bit, the pain, the swelling that you're having on the outside lateral portion of the knee and the back of the knee, probably going to get better too. There's real truth to overtraining. And if your body can't recover between workouts, it might be once a week. There's bodybuilders who can only work a body part once a week because the intensity is so high relative to what they can handle that it takes them that long to recover. And they didn't have surgery and they're not, they're in their early 20s, but still. It's a matter of controlling and dosing the right intensity. I hope that gave you some advice. I hope that pointed you in the right direction. Always go back to your physical therapist. They are the ones that know you. They're the ones that have evaluated you. They have the information for you. I'm just giving general guidelines and advice. This is what I would tell a physical therapy student who is working with me. This is kind of what goes on in my head. Guys, thank you as always. Subscribe to the channel, like the video, and I'll catch you on the next Q&A.